Maybe you can tell us who you are and what you do, and a little bit about what harm reduction in alcohol means to you.
Sure. I'm Brittany Graham, and I work with the Eastside Illicit Drinkers Group for Education. They are a group of individuals who drink illicit alcohol in the downtown Eastside. So illicit alcohol, the way that they describe it, is non-beverage alcohol. So Listerines, mouthwashes in general, rubbing alcohol, hand sanitizer. Mostly the people who are drinking this is not because of preference, but because of access to alcohol. I'd say most of the people in our group have been chronic alcoholics for the majority of their lives, and because of poverty are unable to support their addiction, and are forced to find other ways to support it. Alcohol addiction is really severe, and when people are detoxing, there's a lot of health consequences that come from that. So seizures, tremors, deliriums, even death has been reported, so it's quite serious. So with harm reduction for alcoholics, drinking alcohol can actually be a harm reduction method, which is kind of counterintuitive for most people, but it's actually helping them save their lives. So there's a fine balance, and the group has kind of come together to work together. There's about 60 people that come on a regular basis. We meet once a week and talk about the issues that are happening in their lives and that are happening within the community, and how do we support them and make it easier for them to get beverage alcohol and to reduce their drinking overall. So the group kind of has figured out that, you know, too much alcohol is really bad because people fall down, they black out, they fall into the street, break their arms, get hit by buses. All those things have happened. And too little alcohol, people fall down, have seizures, hurt themselves, end up in hospitals or the morgue. So there's sort of an in-between when someone's trying to figure out where they're going, and it's different for every person, and the group really tries to support people wherever they are. A big thing that they've been working towards is having more access to managed alcohol programs. So a managed alcohol program is where people are given doses of alcohol. There's different versions of that. In Vancouver, there's a medicalized one where they get a dose of alcohol every hour or so. It's a very small program, but has been really beneficial to the people who are on it. They go to the hospital less, they see police less. And then there's a less structured one where they get, you know, like a bottle of wine for the day or half a bottle of wine for the morning. So there's a lot of different ways to reduce harms for people, and I think that's a big one that the group has identified for themselves, is that the way that non-beverage alcohol is affecting their liver and their eyes and their brains is definitely different than beverage alcohol, and that they would like to not be drinking that if they had access to more money or more affordable beverage alcohol. And it seems that the prices of beer, wine, and spirits aren't going to go down, and so the way to do that is through some sort of managed alcohol program. So we're really advocating for that. We'll see when that'll happen, but the other things we're working on are an alcohol treatment guideline with the City of Vancouver and Vancouver Coastal Health. So they're creating one for their doctors as to like where people can get treatments, what kind of drugs they can be on, and so, sort of be more inclusive, because right now there's really not that many services in the downtown east side or healthcare services that address the needs of people who drink alcohol, and they've been widely forgotten. And so it's really dangerous to their health, and we're just trying to show like they're here, they need services, they need help, and they need respect and less stigma. And that's what the group does.